Good afternoon, Mendocino County, and welcome to our Friday update for October 16th. Today, we have with us Dr. Andy Corin, our Public Health Officer, as well as Becky Emery, our Department Operations Center Manager. So with that, I'm going to turn it over to Dr. Corin for our COVID-19 update. Andy, Dr. Corin, you're muted.
Okay, thank you. Live and learn. It'll take me a little longer to learn. Hello, Mendocino. So I'm going to start with statistics, and then we'll go on to some of the other issues that we're facing today in our county. As of last night, October 15th, we had a total of cases that we've had in Mendocino County of 1,077, of whom 62% were in the Hispanic community. That's 670 people. Total quarantine was 184, and on isolation is 60. In the hospital currently, we have 3 of our citizens. 1 is out of county. 1 of the ones hospitalized is from the Hispanic community. 1 is in the intensive care unit, which is the out-of-town person. We've had 21 deaths in our community from COVID-19. Some good news is that our daily case rate, that is the 7-day average, 7-day lag, which is 7 days ago, is decreasing and is now 6.86, which is under the magic number of 7, which puts us in the range, and I'm just going to say range, of the red tier by the governor's program. Now, it's important to understand that we're not in the red tier at this point. We have another week to go, and we've got to really batten down the hatches so we make it there. Because of that, I've done something that I haven't done before, but I want to give a little background. The state has issued guidance for gatherings that we in Mendocino are not going to be able to do because of orders that I released. We are still one of 9 counties in California who are still in purple. So I have elected not to relax the guidance, the guidance for gatherings quite yet. I really want us to get down to the red tier so businesses can open, so we can have other kinds of enterprises going. If we have more outbreaks, which the problem with gatherings is they're at higher risk. If we have more outbreaks, we are likely to be foiled in that march to red. And even if we get in the red tier, we do have the risk of being pushed back. But as a small county, it's going to be harder to push us back to purple than it is to get us down to red. So I really want to get us to red. When we get to red, just to remind some people, some more openings will happen, including hair salons indoors, personal care, places of worship, fitness centers, restaurants, and schools after 2 weeks of being in the red. All of these will be with restrictions, which we'll talk about when we get closer to that. So I just wanted to let people know I'm cautiously optimistic. We've got our first red line in one of these graphs that I'm looking at, but we could easily turn back as happened in mid-September. Other state guidance that's come along this week is in long-term care and skilled nursing facilities. Visitation has been strongly curtailed and restricted, and the state has released guidance making sure that these institutions do allow visitation for our elderly disabled people who have been so lonely through these last months. As far as outbreaks go, we have successfully mitigated the Ken Fowler outbreak, which was a few weeks ago. And recently we've had outbreaks in Covelo and in Point Arena, and increased testing and quality case investigation are bringing these under good control. We still need to be vigilant in our work and in our play so we don't have any more outbreaks. We need to cooperate with the people who do call and not be afraid to answer their questions, not being thorough. We're asking more information about workplaces and schools. And I want to remind people that these people, although they're case control or case investigators, they're not to control you, but we're trying to control the epidemic. The information is all kept confidential. Even the people that you may name that you may have been in contact with in the last 2 weeks won't know it's you who named them. We would get on the telephone and say, we have information to suspect that you may have been in contact with someone who has COVID. And so we'd like to recommend blah, blah, blah. And the other thing is, if people do need to be quarantined or isolated for a limited period of time, the county has resources to help you find your way. So that you're not going to be kicked out on the street. If you need help, if you are already on quarantine or isolation and need help, remember that the call center is at the phone number 472-2759. I'll say it again, 472-2759. And I wanted to just tell a story of a family or one of our citizens who went through this because it illustrates the kind of process this is. So one of our contact investigators, this came from one of our contact investigators, sorry. A firefighter who had returned home from a strike team became symptomatic. He got a test and the test was positive, and he was initially very upset because he was the only income earner in his household. He talked it out with our staff, who got him assistance that he and his family needed. He was able to isolate and the family quarantined, and all 7 members of the fire strike team were also quarantined. They all recovered, and at the end, he admitted that he was sicker than he had let himself believe. So remember that there is available some income supports and unemployment insurance, which our people through the call center can help you get. There's delivery of plates of food if you don't have the food. And for those people who don't have a place to really isolate and quarantine, we do have other resources that people can stay in. So we do want to emphasize that there is a cautious optimism about these numbers, but I also want to remind people that we need to keep ourselves and each other healthy and get tested. And if someone gets sick, you will have the support you need. So again, OptumServe is our testing facility in the Ukiah Fairgrounds. And we've changed those days from Sunday to Thursday, Sunday being a family day. And I want to encourage everybody to test. And if people are having problems, just feeling down or depressed, call our warm line, which is open Monday through Saturday from 7 to 6, 472-2311. And for any questions regarding the health orders, lab results you haven't gotten results for, the call center is open 8:30 in the morning to 5 p.m. Monday through Friday, and that number is 472-2759. We are distributing masks now. There's an organization in town who's distributing masks door to door and educating about COVID recommendations. The lodging industry on the coast is stepping up to start testing their employees, and the chambers of commerce, wine growers, and vintners also are stepping up and looking into doing on-site employee testing. In the future, looking up into the future, there is the influenza epidemic coming up, and we're very concerned about that turning into a twindemic. Both influenza and COVID hitting at the same time could really set ourselves back. Please remember to mask as usual, the social distancing for the COVID, but get your flu shots. Flu shots are much more protective than the masks. Remember, the masks are there to help us protect our neighbors, but they're not necessarily so protective against the catching influenza. So where do you get your flu shots? At your primary care providers, whether those are private docs or clinics, at pharmacies. And for those who have no means to pay, we are having a walk-in clinic on October 20th from 10 to 2 p.m. here at the Public Health Department. Finally, again, it's Halloween, Dia de los Muertos, and this is going to be different this year. No trick-or-treating, but let's make it a happy family day. And last time I issued, I spoke about some orders there, actually been written up into a nice flyer that's going out to households and other organizations. through the schools. The cities and schools and businesses are planning some fun events. So dress up and decorate and have some good treats this year. Keep the risks to a minimum. And I will end my presentation there and ask for any questions.
Thank you, Dr. Corin. So we're going to go next to media questions for our viewers joining us live. If you have questions, go ahead and leave them in the comments, and we will do our best to get to your questions today. So with that, we're going to start with questions emailed to us by KMUD. So the first question is, there has been a lot of talk locally about the state of California's tiered approach, not addressing the differences between rural and urban counties. What sort of accommodations or changes to the state of California's tiered system have rural county public health officers been advocating for?
Well, we've been advocating and made a good case, and actually part of their equity metrics has incorporated some of those issues. There's still more to deal with, but for one thing, the smaller counties are not going to be judged on the percent of positivity of the tests. We want to make sure that people are tested, and the more testing, potentially the more positivity. But actually what's turned out is we've done very well on percent positivity. And if you looked at where if they put us into a tier based on that, we'd be in the range of the orange tier. So, but we're not being counted on that. The other thing is that we're going through the same tiers to get down to the lower, or I should say the higher number tiers. We go from 1 to 2 to 3, from purple to red to orange to yellow. And it is similarly difficult for us from the statistical point of view to move from the lower tiers to the higher tiers, the more open tiers. But going backwards, where the issue is we don't want to have a county in the red tier and then for very small numbers of cases be flipped back to the purple. And then the enterprises that open up while in the red tier would have to then close down on the purple tier. And the economy would go back and forth, and it would not be good. So the adjustment has been made in how the metrics are looked at for the small counties. We're being a rural county. There are other issues that affect us, and I think that that's being looked at by the state. We keep, petitioning organizations like CSAC and others that are close to the government who can help make those rules, and they're listening very closely to us. So I think there's some movement on the part of the state to understand where we are and how we differ from the larger counties, and we definitely do. So I think there's some movement.
There's a second question that goes along with that, and you touched on it a little bit. Dr. Corin, can you see any aspect of California's tiered system that doesn't adequately address rural counties' navigation of the pandemic, like Mendocino?
Well, we have a real shortage in this county of a kind of technological help, epidemiological help that could help us analyze what the issues are and how to get around them. That's one issue. We're a poor county, and although now I should go back and just say the equity measures do incorporate for both large and small counties our investment into dealing with the disparities, and we just submitted that yesterday, and that's going to be okay. But that's a permissive requirement that would allow us to move along the tiers. Other larger counties actually have to show some progress in how the case rates are decreasing based on their zip codes, but zip codes that are graded by a program called Healthy. It's Healthy. Oh, I'm missing the name right now. Healthy Communities Index, I think is what it is, or Healthy Population Index, HPI. And while we have to understand what that is as a prerequisite to moving from tier to tier, we don't have to show the same progress based on that measure. But there are other things that we will need. I mean, we have a spread out county. There are differences in how we get communication out, how people come into our health centers and our hospitals. And those are not the kind of things that larger urban counties go through. So there's more to be done.
Thank you, Dr. Corin. So we'll move over to media questions. I'll go ahead and start with Mendocino Action News. You can unmute and ask your questions.
All right, thank you for doing this meeting. I really appreciate your guys' time. One of my first questions is, there was a concern regarding reopening certain sectors such as salons. Since they reopened, have we seen any area of concern or outbreaks related to it?
Not yet, not to my knowledge, not any outbreaks. No.
That's great. The other question is, if we believe that masks are helping to reduce the COVID-19 numbers, would they do the same with the flu season, or do you still believe we'll see that peak?
That's a big question. Okay. The masks that we wear, the cloth masks, do protect some against the spread of COVID, but it does that by stopping the source of those COVID germs, and so less spread. Whether that will do it with the flu is a little unclear, and it certainly doesn't protect one from the flu like a medical grade mask would. So the masking may, and that would be great, but we don't know if this is going to be a light year or a heavy year. So a lot of this is conjecture. People are saying, well, it'd be a light season because we're all wearing masks, and very well might be, but it might be one of those seasons where flu is just more rampant, flu is just more serious, might be a bad flu year, might be a year where the flu vaccines are a little less effective. So we want to use all the protections we can, because you can be sick with the flu, you can be sick with COVID, and from a physician point of view, from a provider point of view, we won't know the difference necessarily. That's an important problem, because how do you treat it? There are treatments for mild outpatient flu. There aren't treatments for mild outpatient COVID, and yet you can spread it around to your family and your neighbors. So what we want, and coworkers. So what we want to do is we want to make sure everybody is really protected against influenza. That would knock out a good part of our concern, and part of all of this work is being done so we don't peak and we don't overload our clinics, hospitals, and intensive care units. Every year flu does make a stress on the hospitals, and we get through them because we have the hospital capacity to treat the more ill patients. But if we lose that, there are going to be people out in the community who have illness and we just can't treat them. So that's our big challenge. Other questions?
Thank you, Danella with Mendocino Action News. We'll move over to Susan with the Independent Coast Observer. Susan, you can unmute and ask your questions.
Hi, thank you for doing this. This is great. I had a question about the outbreaks on the Indian reservations. How are you doing in terms of controlling those?
Well, we have partnered with the Indian health clinics and the tribes themselves. Remember that Native Americans are a different nation, and although we have relations with them and they have an important part in our state government, we don't just enter and take over what's going on in the Native communities. However, the Native clinics, the one up in Buffalo and Round Valley, they have excellent contact investigators and tracers that have been embedded and know the community. They have done a great job in mitigating that experience. Down in Point Arena, Manchester, Manchester Tribe has a contract for public health services and medical services with a Sonoma County clinic. And we have been in contact with Sonoma County Clinic, the Manchester Tribal Administrator, and the State Indian Health Board. And so we're all working together to get these under control. And I can happily say that I think that the one in Round Valley is very well controlled. We haven't had new cases for several days. Manchester has been very good. We've done a lot of testing in that area with a lot of, all negatives. There were a couple of positives on the reservation in the last couple of days, but they were not linked epidemiologically to any of the others. And so we think that the outbreak is really coming under good control, but we're still doing another round of testing at least this week to make sure.
So to follow up, was that number of the couple of positives in Point Arena, Manchester, is that why the number for the South Coast went up slightly in the last day or two?
I'm sure it contributed to the number going up, but we did have yesterday we had a number of positive cases, and I would not blame it all on the Manchester outbreak. I think that was a very small portion of what we experienced yesterday.
Okay, so are you going to tell us what you experienced yesterday?
Oh, we had 14 new cases yesterday. That was a lot of cases, more than we want, obviously. All but 2 were contacted yesterday, and we're expecting that the other one will be contacted or probably was contacted today.
Okay, so the 14 includes the ones in Point Arena,
Yes.
Manchester. Okay, thank you very much.
Thank you, Susan. Next, we'll move over to Kate Maxwell with the Mendocino Voice. Kate?
Hi, thanks, Sarah. So I wanted to ask sort of a bigger picture question. There's been a lot of conversation about how rural counties compare to urban counties, and the state has implemented different metrics and tiered systems over the last 6 months to try and convey to the public the severity of the outbreak. But it seems from what I can tell that essentially since the spring, Mendocino County, as compared to, say, Humboldt and Lake County, has remained at a fairly high level of positive cases, a high level of case growth, whether or not that's purple tier or whatever we're calling it right now. The number of cases, Humboldt just passed 500. We have well over 1,000, and they have a significantly larger population. We have 21 deaths, Lake County has 14. And they've been able to decrease those surges seemingly more effectively than us. So I was wondering if you could speak at all, those are 2 neighboring counties with ballpark population, similar socioeconomic, rural kinds of residents. If you have any ideas about why Mendocino has such a greater severity of COVID happening here, why we have not been able to get it under control per se in the way that those 2 counties have, and if there's lessons we can learn from those counties about what we could do here.
As far as comparing them, I certainly can't contest your figures, but I can't tell you that I have specific reasons why. Remember that Humboldt County had most of their initial cases as a result of a fairly large outbreak before we had ours. And it may be that experience imparted more information and more education to the people in the county. I don't know, honestly. So my answer is I don't know.
I guess as a public health officer, are there things that, as you look at what they're doing in those counties, are there things that you think we could do here in Mendocino that might get us more towards those ballpark kinds of numbers than what we've seen here?
Well, of course, being in the red tier, they're even more open than we are. But I don't think that their restrictions early on were any more than ours were. So I don't think that, we have looked at that and that's not a case. So maybe how their population is, following the orders, and I don't have insight into why that is.
Okay, so I guess the second question is somewhat related. It seems like we have a really high number of cases that are just kind of designated community spread. And I don't know how much of that might be the issues with contact tracing that you alluded to earlier in the presentation. But it seems like that is kind of a gap in information where it makes it hard for people to know, where the cases are coming from and therefore how to be personally proactive. And so you mentioned that as a poorer county, we don't have access to certain kinds of epidemiological expertise or technology that might facilitate us being able to get this under control. I don't know if some of that would also just be hiring more contact tracers or what, but maybe if you could, if we did suddenly get a huge grant from the state or the county, if you could elaborate on what you think could be happening here to try and get our numbers down, whether or not that's within our own existing resources or if we had a sudden huge grant that would allow for some of the things you alluded to.
Well, we are trying to get some epidemiological help to understand some of the questions that you're raising. That's very important. And we are also employing more contact investigators and contact tracers. And in particular, we're targeting people who are bilingual and bicultural, because that has been a deficiency in our contact investigators and contact tracers. And so without that, it's hard to, communicate with the people who might have had positive tests enough to find out who else they might have contacted, and on and on. So yes, those are the areas that we do. We're working on increased testing and putting testing from OptumServe on Sunday has attracted a lot more people who work around the week and don't have time off, our essential workers. And we are working with industrial groups, the Chamber of Commerce, wine growers, lodging, to get some testing off-site in agricultural areas and the tourist areas and so on and so forth. But we do need definitely more bilingual, bicultural contact investigators and contact tracers, which is what we're working on.
Okay, and so in terms of the tech, would that be like rapid testing, or what are some of the things that we don't necessarily have available? Could you elaborate on that at all?
So we do have rapid testing available, and we just got a shipment of the newest, latest stuff, but actually we have in our clinics, all but 3 have some rapid testing and have had some rapid testing. But the analysis part of this, to see where we can direct our efforts more specifically, and if there's a way that we can direct our efforts more specifically, that's what an epidemiologist does. They look at the statistics and they assess, oh, well, here's a gap, and here's what you can do, and how do you approach this? And I don't have that information, but that's the kind of insight that we can get.
Okay, thanks.
All right.
Thank you, Kate. We have a few questions coming in from our viewers, and as a reminder, you can leave your comments below and we'll try to get to as many of them as we can. The first question I have coming up is around playgrounds and when will the playgrounds open in our county? So I have a little information on that if you would like me to start out, Dr. Koren.
Sure.
So parks are allowed to be open and playgrounds are allowed to be open. The agencies that do manage the playgrounds have to follow some state guidance. So we do have an FAQ on our website about it, but you're going to want to contact your local agency, maybe it's a special district or a city that manages the park, to see if the playground you'd like to visit is currently open or what their opening plan looks like.
We've dealt with this with the city managers who really oversight the most of the public parks, and they really don't have the personnel to make sure that the playgrounds could be open safely. So they are working on it. There is in Ukiah some group activities that they've had, and they continue to have them, but they have to make reservations for that particular program, that particular day, and make sure all the cleanup is done before and after, and the spacing and masks and so on. They really manage that area. So we don't have that in all of our towns.
The next question we have is around testing. They would like to know if there's other options for testing so they don't have to drive into Ukiah where there is a higher rate of COVID. So if you want to talk about the other surveillance opportunities we've been working with, that'd be great.
So we have been doing a lot of testing on the coast, primarily because of the outbreak, and that's a little different, but it's the same as surveillance testing. We're screening testing because there has been a nearby outbreak, but anyone who wants to go, they can go to Mendocino Community Clinic or to, I'm going to forget the names again. It's MCS, which is it, Becky? RCMS, thank you, RCMS. Redwood Coast Medical Center. Anderson Valley has some testing available. The clinics in Laytonville and here in Ukiah, Mendocino Community Health Center, MCHC. And the other one is the Consolidated Tribal, has testing that they're doing pretty frequently along the 101 corridor. Let me see, am I leaving anybody out? Povolo Round Valley is doing it, but it's more following up the outbreak testing, so it's more screening testing. I think I've hit the clinics, and that is one of the reasons why we're looking to help from the lodging industry and the businesses here in Ukiah and the vintners, the wine growers, and another group that's already doing it up in the north of the county are the cannabis growers. And so they're starting to put in on-site or community locations where they're paying to do more of the testing, and that'll be outside of Ukiah. But no, this kind of program needs to be decentralized, especially in a large county.
Well, and I would add, oh, sorry, Sarah. I was going to say, we're probably going to do the same one. But I would add that we've just updated our website. So if you go to our website and you click on the COVID-19 testing, there's a sub-tab called Local Surveillance Testing Opportunities throughout Mendocino County. It lists the sites and how to access those sites. Some of them are by appointment and others are just by showing up at the right place at the right time. And so we have that information posted on the website for people to be able to access that testing, and we will be updating that monthly as we continue with our updated schedules in partnership with our clinics and community.
That's exactly what I was going to say. You can visit mendocinocounty.org, click here for COVID info, or mendocinocounty.org/COVID-19. And you can find out the testing opportunities in your area, and we've broken it down by region for you. We have another question coming in, and this is around schools. Will there be testing requirements for when schools open back up, assuming we move to the red tier and stay there for at least 2 weeks?
So the schools will be advised, it's a recommendation from the state that they test all the teachers and staff. The recommendation is for them to test everyone every 2 months. So they'll probably do 25% every 2 weeks, and that'll be 100% every 2 months. They are trying to work out the details about doing that. And we want to make sure that that can be enforced or monitored in some way. but that's going to be happening. Whether the students will be tested is not part of the purview of the schools. We certainly hope that they will, and the difficulty will be the ones that are away from Ukiah, because there's limited testing away from Ukiah, but that's where the industrial partnership will really help, because other people would probably be able to take advantage of a van that might be, let's say, in the southeast side of the county near a vineyard. So we're working on increasing the availability of testing outside of Ukiah.
We have another viewer that would like you to elaborate on what type of testing is going to look like with lodging and what work's been done in the lodging arena.
I'd like to give you more information. I don't have it. They're working on it themselves. There are a number of opportunities. They'll probably do some partnering with clinics. They may bring some wraparound services in, a van that could come up, do the tests, take the tests back, and run them in their own lab. So it will probably be partnerships all over town. We're trying to get the industries also, if it's possible, to partner with the schools, which is another big group that has to be done. And the more people who want to get it done, the better leverage we'll have with the company to bargain prices down.
Thank you, Dr. Koren. Those are all of our questions for today. So I'm just going to remind the viewers of a few different things. We will be issuing that revised shelter-in-place order with that information about gathering restrictions because of our purple tier by 5 o'clock today. For those of you that want more information on the Halloween guidance, that is on our website, as well as flyers for the upcoming holidays. And we will have more information over the next couple of weeks, just focusing on the holidays. And with that, I'll turn it over to Dr. Koren for any final words before we end this Friday update.
Stay safe, continue masking, social distancing, hygiene, all those things. Get tested. Remember our OptumServe site, your clinics, the tests that they're there. That's the way we discover problems in the community, and we can mitigate them. We can wrap ourselves around them. But have a fun time during Halloween. Also plan some events that are safe, and we hopefully will be in the red soon, but we have to make sure that we're careful even when we get there.
And with that, we will see you all at our next update, which will be November 6th at 2 p.m. And if you missed part of today's update, you can watch the replay on Facebook or our YouTube channel. Have a wonderful weekend.